And just before we go on another break, we'd like to bring this news just in to your attention. Nigeria has successfully reduced the number of Ebola cases in the country to 1. That's according to the Minister of Health, Professor Onyebuchi Chukwu, who said that as of today, only 1 Ebola patient remains in isolation in Nigeria, down from the 13 cases the country confirmed since the outbreak of the virus in July. Mr. Chukwu said this at a press conference much earlier, just ended a few minutes ago. A deadly virus was first brought to Nigeria, as we remember, 38 days ago by a Liberian-American man, Patrick Sawyer. Mr. Sawyer later died, but after health workers who treated him had contracted the virus. Mr. Chukwu said that so far, Nigeria has had 13 cases, including the index case. 5 of those infected died, while 7 have successfully recovered and have been discharged. 2 of the nurses who managed Mr. Sawyer were discharged on Monday at the isolation center in Lagos. With this report, Professor Chukwu says that Nigeria has been able to curtail Ebola in the country. All the 129 people who were under surveillance have completed the 21 days observation incubation period, and only 1 person was found to be symptomatic and is still being observed. We'll have more on this much later as we brief you on it. But what we need to know now is, according to the Minister of Health, Professor Onyebuchi Chukwu, Nigeria has successfully reduced the number of Ebola cases in the country to 1. As of earlier today, only 1 Ebola patient remained in the isolation units in Lagos, down from 13 cases the country confirmed, which had been growing for up to 38 days now. It's really good news.
It's really good news, and I mean, it's one thing, you know, for you to have this sort of epidemic, but of course the authorities were quick enough. Kudos to all those who did a new man's job in curtailing the disease, right from the airports to the hospital.
Exactly.
You know.
We did observe an aggressive attack on the outbreak itself here in Nigeria.